Hello, Dr. Sharma. Thank you once again for joining us for another session on mental health.
Thank you, Dr. Vasconcelos. Good to be back with you.
Doc, today is July 11, 2020, and continuing with our theme on ethical principles, can you please elaborate on beneficence and non-maleficence, please?
Yes, Doc. So those are the last two principles that we are going to discuss today. We talked about autonomy before, the rights of the individual. We talked about the principle of justice, which looks at fairness. In the medical model, justice doesn't follow necessarily the laws of a court, though you could apply them, of course, but we look at fairness, what's in the benefit of all. And in the benefit of all, we have the principles of beneficence, which is looking at the benefits, doing good. So as doctors, healthcare workers, and generally everybody with good value systems that should be caring for others, we want to do the best, do good. Teachers, nurses. So it's not necessarily applied only to medicine. And then we have the principle of non-malfeasance, which is do no harm. And it's kind of similar if you think about it. I'm doing good, at the same time, I'm doing no harm. Why should there be a principle of non-malfeasance? But they have to do that because in doing good, sometimes we have to do harm. And I think this COVID crisis now brings that out because there's situations where once we are doing good, we could have a conflict between that principle and the principle of non-malfeasance, where we may also be doing harm. So as you know, there is this big controversy going on now in Florida over the wearing of a mask. So persons are complaining that it's restricting their breathing. Is their right to choose by the principle of autonomy? So we have several principles, ethical principles operating. And usually we see ethical principles operate in times of conflict. So here we have in the COVID crisis, conflict between individual rights and the rights of the society, the public, on the public health laws, and we have the rights of the administrators and leaders who have the responsibility for the people. So in terms of doing good, we want to be fair to persons. We don't want to harm them. But here is a situation that we see into with the COVID crisis, where we're asking people to stay home, and there's some restriction for movement. There's curfews that are more severe in one place versus the other. Some places are more open. We had a more open policy in Sweden. We had more open policies in Brazil, and as a consequence, we saw some negative data coming out with respect to numbers. So again, the politicians and the administrators, they have to weigh the benefits of people versus doing harm. And the doing harm here, I think, Doc, is not having people go to work. So it's over 4 months now since we've seen the sort of lockdown in many places, and it's causing people distress because people can't work. They're going to have a problem in maintaining their mortgages and payments. And I saw a report out in the USA where persons, many people are not able to maintain mortgage payments and have not made any payments for the last 4 months. Of course, there's fair amount of tolerance, and we commend the banks and the business societies that are protecting people's economy, but for how long can they do that? And for how long can we not have a task force out there? So here's that conflict that goes on between beneficence and not to do harm, because we want to not have the spread of the virus, but at the same time, we don't want people to be at home not being able to work, and the country's economies are on the standstill. We're in an economic crisis. Where is the balance, and how can we find that balance? So here's an example of that conflict.
Doc, right now, you mentioned two countries, interestingly, Sweden and Brazil. We see that, for example, you also mentioned Florida. We see, for example, the amount of cases we had in one day in Florida exceed the total number of cases in the entire European Union. And
Yes.
within the European Union, the country who took this open approach was Sweden. And we see now the consequences of poor leadership, which we also see in Brazil, which borders with Guyana. So the question is, how do we resolve these conflicts?
So it's got to be a balance between doing good by protecting the society from this virus, weighing that with having people being able to work. When I reflected on this, I find that there are some solutions that we can apply. And I think Florida is trying to do that with having people recognize the importance of wearing the mask, that not coughing on individual because this is primarily a droplet infection, and also keeping the distance. So if we can maintain those two processes, one, the wearing of the mask, and two, keeping the distance, there should be a fair amount of control. Of course, there's other talks now that the virus is in the air and it can come down by droplets, and there's some, dispute over that. We're still not there with the vaccines. So there is still that concern, and I think it's fear. People have this sense of fear. I think what WHO now is doing is a review of everything because they want to say, are we doing the right thing by restricting persons so much? Should we allow people to go to work? As happens here in Ghana, people are working as normally as I can see. The hospital is filled with people, the staff are working. The roads are crowded with cars as normal. There's no parking space, so I can't say that people are staying home. I was hoping that if they're staying home, I'll get some parking, but you're still not getting that. So it means that people are out there working in the banks and so on. So there's a fair amount of crowded. So yet the pattern of the virus in Guyana is more in the interior regions, which is the same thing like Brazil. So it means that our vulnerable population are more of the indigenous population, especially in South America. So I think we've got to be guided by data. So to answer the question, we need to be guided by data and common sense, and we need to also have that practice of fairness because we cannot keep our farmers, for example, from their farms. And I saw farmers protesting in one region in Guyana that they were not allowed to go farming. Now, they are the breadbasket of the nation. If we are keeping our farmers away, what happens when food runs out? So how can you, as a government, maintain people forever? In India, they were trying to do that by giving them packages. But for how long can you maintain millions of persons? So there must be a balance, Mark. We can't just shut down ourselves and lock away in a prison. Also, I believe that the numbers of people who actually contract uh, the, or actually suffer fatality are small compared to the numbers who contract the illness. So the recovery rate is fairly high. Yet even with that high recovery rate, um, there's no like proposal for people to take the situation too lightly. And I don't want people to believe that I'm promoting a sort of light look towards the viral illness. It's a very dangerous one. But I still feel that we must be guided by proper data, by an analysis, medical analysis of what is really happening. For example, I would like to know exactly how those people who contracted the illness contracted it. If they did not wear a mask, for example, I'm not sure we're getting enough of that data. Are they wearing homemade masks versus the very highly protective masks? What exactly is going on? Are those people who unfortunately die because of the illness are persons in extremely good health, or do they carry, all of them carry some medical risk factor that make them more vulnerable? We've seen cases who survive, even the elderly Prince Charles, he survived. Boris Johnson in the UK survived, you know. Now we have Bolsonaro himself having it. What is going to happen to him, we don't know. So far, your president is now wearing a mask and he's not caught it. So, you know, I got well, the point I'm trying to make is that there's significant fear attached to this illness. And with that fear becomes sometimes uh, overprotection. So we don't want to cause harm, yet we cause it harm because economies must continue. We must continue to have persons working. It's not healthy for men and women who are able to work to not be able to do that. So there should be a balance, and that balance should be guided by the principle of justice.
Doc, you made some very good points. One is that we see the impact this COVID-19 have on the wealthy and the poor and the disparity between the two. In addition to that, we see the consequences of poor leadership. When you have people who do not respect data and respect science, then by implication, when they're a leader, they have followers that are in the shadow of ignorance and stupidity. So I think it's so important to listen to the scientists and the
Yes.
experts like yourself and be guided by informed and intelligent data and not stupidity and ignorance, which is self-inflicted many times. But
Yeah, you
thank
put
you.
that very well.
And well, thank you for your commitment, Doc, in educating people, in seeking a logical, intelligent approach based on facts. And thank you so much for all you do. Any final thoughts?
So I think you got it really right there that we should be guided by proper data. We call it evidence-based medicine. So we can't just say it's my personal belief, and I really don't want to express personal beliefs too because I believe that personally, I'm going to express one that we will overcome this viral illness as we have overcome all the others in the history of mankind. And I think we need to have that in our mind that we will overcome. When we had the AIDS crisis, there was so much fear about people not wanting to touch people because they would get contract the illness by touching them or sharing their glasses and utensils. And that was untrue. So there's a lot of myths and so on that abound. But coming back to what you say, it's not my personal belief about this situation. It's being guided by the medical facts. And those who provide the medical facts have to have that sense of responsibility too, not to be providing facts that may be of benefit to any person economically. You know, when you look at that movie Contagion, persons were benefiting from this illness. Even the situation now, there are a lot of spin-off industries are coming up because of this condition. And while they're needed, you know, there is a benefit. So people can't abuse that. You know, we had a situation, people are selling protective equipment at exorbitant prices, and that's not fair. So there is a need to weigh all these factors, look at our economy. We need very sensible leadership. I love the point you're making. We have to have leadership who is responsible for the people. The word politician is for the people. It is for the people, not for themselves. And we have politicians who are thinking about only their welfare or their family welfare, or their friends' welfare, not for the people, the country. We're not going to progress. So I hope that's my message that we should have proper guidance, good leadership who will set up the right committees with the right people on it, and we will be able to work together, united as human beings. Together we will fight this illness, we will win it. So that's my final take on that one.
Amen. Thank you so much, Doc. God bless you. You stay safe, and I look forward to seeing you soon.
Thank you, Doc. You take care of yourself.